Welcome, everybody. And today I am very excited to have the American Mental Health Counseling Association with us to discuss their new publication, Beyond a Perfect Storm: How Racism, COVID-19, and Economic Meltdown Imperil Our Mental Health. So to discuss this, we have Joel Miller with us. He's the Executive Director and the CEO of the American Mental Health Counseling Association. And then we have Angele Moss-Baker. She is the current president of the American Mental Health Counseling Association. And both of them were a big part of putting this document together. So this document really helps us clinicians understand our current environment, which we have a lot going on, right? So it's really important to take a look at this. So I really appreciate both of you, being here for this interview and help us understand how it is that we could best utilize this document and what it has for us. So just to get started, can you explain who this document is for? Who's the target audience for this document?
Sure, I'll be glad to jump in. Yeah, the primary audiences for the Beyond a Perfect Storm report were really, federal and state policymakers, specifically really zeroing in and focusing on key health committee members of Congress and their staffs, as well as the public at large, and trying to, get a lot of media attention on the problems that we've identified in the report, as well as key behavioral health organizational, decision makers who are definitely involved in this issue.
Okay, excellent. Yeah, and what are the goals? I mean, when you decided, hey, let's create this document, why was that? What were you hoping for from this document?
Well, we were actually hoping to just keep the public and stakeholders informed of the convergence of these crises that are occurring in our community and actually globally, but being more specific to the Americans here, we're looking at the pandemic, the folks that are ill, folks that are dying, the impact that the pandemic is having on everyone, financially, the economic recession, health care, health disparities, and also the bringing attention to the global protests regarding systemic racism and how it impacts folks' mental health.
Mm-hmm. Yeah, so one thing is to help people be informed in terms of what's going on for people across our nation.
Yeah,
giving these really significant stressors on them. So that's one thing. Keep them informed. Are there any other goals for putting this together?
No, go ahead, Joel.
Well, you can speak on this, Joel. We're also always looking to, increase the public's access to mental health treatment. And that includes the profession that we represent, licensed professional counselors, licensed clinical mental health counselors. So Joel, you want to speak more on that?
Yeah, I was just going to highlight that, due to the confluence of these major crises that Angele highlighted, in terms of the COVID-19 health pandemic, the economic meltdown and downturn that we've seen, and this kind of ongoing systemic racism, that it's created this massive fourth crisis and really this tsunami of mental health conditions that we're experiencing across the country. And we have seen, and based on our report, this major uptick in anxiety and depressive disorder specifically. And if we don't get a handle on this quickly, we're afraid we're going to see this kind of massive increase of untreated mental health conditions, which will just lead to more crises down the road.
Mm-hmm. Yeah.
And I may add, when we talk about mental illness, I often like to use the term behavioral health disorders because, I'm a proponent of looking at co-occurring disorders. And so I'm looking at both the mental health disorders, the substance use disorders, physical health disorders. And so we really want to promote the development of integrated treatment practices along our systems of care. Many systems say that they're providing these services, and I think they probably are at the best that they know how. But we need to do a better job, and we need sometimes more funding to be able to put those supports and practices in place. So just to promote that as well.
Okay, yep, that makes perfect sense. And what went into the development of this document? I'm sure you had to spend several hours, a lot of data research and analysis, and et cetera. So what was the process like, and what had to go into it?
Joe?
We began to see back in April several kind of anecdotal articles and stories in newspapers, social media, on the number of people who were losing their jobs. The school system shut down, so more and more parents were afraid what was going to happen to their children with disabilities, looking forward, how are they going to get the care they needed? And we began to look at not only that anecdotal information, but we began to look at some surveys that were being conducted by the United States Census Bureau, by the CDC, the Centers for Disease Control and Prevention. And they began to do weekly surveys of Americans, asking them about their mental health. And what we found was really amazing, as we highlighted in the report, that over 41% of Americans were reporting some kind of mental health disorder up, through the end of July of this year, the latest reported data. But there's been a huge increase just over this period of time. In April, 33% of Americans were reporting a mental health disorder, and now it's upticked to 41%. So we want to highlight in this report that the problem is constantly getting worse.
Yeah. So let me understand. So what was a percentage of behavioral health disorders or complaints prior to COVID versus your most recent data access that you have?
The 2019 data that the Census Bureau was reporting was that only about 7 to 8% of people were reporting anxiety and depressive disorders.
Yes, 7 to 8%. Okay.
Only 7 to 8% in that area. And now we're talking in the upper 30s and early 40% of Americans reporting, mental health disorders, and specifically in the anxiety and depressive disorder area. So we've seen this incredible percentage increase from 7% of Americans to a little bit over 40% of Americans reporting mental health disorders.
Yeah, that is very significant.
Yeah, that's huge.
Yeah. And then, so what other data points would you think would be really important to notate?
Yeah. Go ahead.
I was going to mention, when we talk about anxiety, a lot of times we're speaking more on generalized anxiety disorder, but we do have a category of trauma and trauma-related stressors. And so we're seeing an uptick in the percentage of people who are reporting trauma-related stress. And this is also associated with what we're watching on the media in terms of the protests. It's in addition to the deaths that are related to COVID, their grief issues in which people are feeling very traumatized behind all of these negative, outcomes as a result of the pandemic. So, I want to mention the trauma piece. I also want to mention the percentages regarding substance use. And I don't have the numbers for the overdoses at this time, but, because of the social distancing, those in treatment are challenged with how they are receiving their care. In addition to those that are in recovery, because of social distancing, they're not able to access the their meetings, their support meetings, other than them being virtual at this time. But the social isolation can be a trigger for relapse. So we're seeing a high number of people relapsing, which increases your numbers of the possible co-occurring disorders, people with depression and a substance use disorder. We've seen some uptick in suicide. Joel, do you want to speak on the suicides?
Yes. I was going to mention, just to highlight what Angele just mentioned, is that 14%, based on our work and our projections, is that 14% of Americans are reporting having started or increased substance use to cope with the stress due to and related to the COVID-19 pandemic. And related to suicide, 11% reported having seriously considered suicide in the last 30 days. And so that's an ongoing problem that's being reported in the data that we're seeing.
Yeah, that is quite significant. And I've heard that there's been an increase too in domestic abuse and having an outlet or support if you're in a situation of domestic abuse. Was that part of the study or no?
It wasn't specifically part of the study, but we know that that's an offshoot of the problems that we're seeing due to the COVID-19 pandemic and the economic stress that we're witnessing, and the stay-at-home orders that are a result of those activities.
Mm-hmm. So we have a real increase in need, but the availability of clinicians and services, that likely is not changing. Maybe even temporarily has decreased a bit. I don't know. So how do you see us better fulfilling the need, given the fact that we have a shortage of behavioral health professionals and probably always have? Yeah,
I'll speak to that just very quickly. That one area that we think we can do a lot is that currently the Medicare program does not reimburse clinical mental health counselors and marriage and family therapists for treatment to Medicare beneficiaries, older adults with mental health conditions. And there's a bill that's been introduced that would allow mental health counselors and marriage and family therapists to receive reimbursement. And what we look at is that we basically have an underutilized workforce for people and older adults age 50 and older who aren't receiving care because they're having trouble seeing clinicians who unfortunately aren't accepting patients and clients with those conditions. So we know in one clean swoop, we can add 100,000 practitioners to the Medicare program, mental health counselors and marriage and family therapists, to address that particular problem. And unfortunately, just very quickly, we've seen over the years at the federal level and at the state level, incredible significant cutbacks in funding for mental health services. And one of the main reasons we wanted to issue this report is the time is now to put that funding back for direct services and direct support services for people.
Mm-hmm. Mm-hmm. Yeah, certainly. It seems like a lot of other regulation changes happen very quickly with the pandemic and these other situations. So it seems like that is something that would be doable.
It would be.
Yeah. So what is it that clinicians and those listening to this, what is it that we can do, listening right now to help with the efforts, with the goals that you have for this publication?
Well, we're really hoping that, all clinicians, behavioral health practitioners, professionals will just become very energized to reach out to their, lawmakers, and advocate for these things that we're asking for, and to advocate for their own profession and the work that they're doing with the people that they serve in their community. There's a need for increased funding. There's a need for our voice to be heard. And with the tsunami of the crises that we have going on, we just see it it's increasing, and it's going to get worse. And we need to be prepared. We need to look at where folks can access services and who's eligible to provide those services. And we, as licensed professional counselors, clinical mental health counselors, are more than qualified to provide these services. So advocacy, when they receive these call to action, we need people to act on it.
Yeah.
Joe?
Absolutely. We hope that this report will, energize clinicians and policymakers. There's been a lot of discussion, about a fourth COVID-19 economic stimulus package. And we think it would be really important in that piece of legislation that's still being negotiated to increase funding for behavioral health services across the board, and include language that would allow, clinical mental health counselors to receive reimbursement for treating, Medicare beneficiaries. So there's some real opportunities here. We know that community behavioral health centers are hurting very badly, during this period, as more people are not going in to seek care. So they're losing a lot of funding. So there's a lot of opportunities between the economic stimulus package and individual pieces of legislation in terms of reimbursement and increased funding that can go a long way to make a dent. Otherwise, I am afraid that we will see a lot of people go untreated, and those conditions will worsen, and it will simply add costs to the system. So it'll be a really defeating purpose here if we don't take action right now.
Mm-hmm, mm-hmm. Yeah, excellent. So how is reading the document? And again, this is a free publication created and provided by the American Mental Health Counseling Association. So for clinicians, legislators, decision makers, why should they read through this document? Let's start with just clinicians. So they should be, for clinicians to be informed about the facts and the data, the impact of these things going on in our nation is vital. Is there guidance or other things that clinicians should get out of this document?
Absolutely. Some of the things that Angele and I have highlighted here are included in the report, and we've also laid out several other policy and program recommendations. In addition to the legislative opportunities we just highlighted, there's other opportunities at the program, at the private sector level, in terms of doing a better job of integrating healthcare services, mental health services, and substance use services in an integrated, fashion to address the needs of clients in a whole person way. So we do recommend not only these legislative activities, but key proposals at the local level, including more activity to help train, clinicians in the telemental health area.
Mm-hmm. Yeah. And what further work needs to be done? Is there going to be a follow-up document, or is that to be seen?
We do plan to issue a follow-up report as we continue to review the data that's coming out of these government agencies like CDC, the Census Bureau, the National Center for Health Statistics, that we will do a follow-up report because we are afraid we're going to continue to see this gradual uptick in the number of people with mental health conditions, many of them going untreated. So we continue to have the idea of hammering away that we need to take action right now and not postpone action, because we feel that will be detrimental to people with mental health conditions and more people coming into the system who are having trouble finding ways to get care.
Mm-hmm. And for easy access to partner in advocacy efforts, would you refer people to your website, to the advocacy page, or what would be a great resource to find out what is it specifically that they need to do in terms of writing letters to legislators and supporting different efforts?
Yeah, we have place on our website, the ability to access the Beyond the Perfect Storm report very quickly. And we have a special landing page that we've created, which will allow people who come to the website to just click on that landing site. And it provides instructions and guidance on how to reach your elected official in your state, your 2 senators and your member in the House of Representatives.
Is that the call to action page here?
Yes.
Yes, we do. And there's a call to action specifically related to the report and to some of the individual bills and legislative activities that we've highlighted.
Yep. Excellent. Fantastic. So what this is it's AMHCA.org.
That's correct.
For the American Mental Health Counseling Association.org. AMHCA.org. Excellent. Yeah. So thank you very much, for all this information, for doing the report in the first place, because it's important for people to have somewhere to go to get accurate information, to be updated in terms of the behavioral health of our nation, what the needs are, and how is it that we can actually make the best, improvements. We're all in this together, and people are going through a horrible time. Even if us ourselves are protected from a lot of this, like I think of myself, luckily I've been quite protected from a lot of the traumatic and difficult things going on, and it's so important for me to be aware of what a lot of people that are personally directly impacted, what it is that they're truly going through. And sometimes I find it very difficult to hear the truth, the reality, the facts, and how to make a difference in a good, healthy, effective way. Because as you know, a lot of the things we hear are not so helpful. Yeah. So I really appreciate all that you're doing, and thank you very much.
Thanks for having me.